So my colleague Adam Cohen presented an important study in AL amyloidosis to address the question of relapsed hematologic disease, which remains a significant problem in AL amyloidosis, even though we have employed novel chemotherapy drugs from myeloma in AL amyloidosis and have shown improvements. We still do not get all patients into a hematologic remission. So Dr. Cohen explored the use of Carfilzomib, which is a second-generation proteasome inhibitor, in AL amyloidosis patients who have previously treated disease but have need for further chemotherapy. The issue with Carfilzomib is that it has a fairly strong toxicity signal, both in several organ systems that are important to AL amyloidosis, including cardiac, pulmonary, and renal. And so it was important to do a very carefully designed phase 1 study of this agent to see if it's even feasible in this population. And he was able to show that, in fact, the hematologic response rates were actually quite high. The overall response rates were around 60%, which is quite high for amyloidosis patients who have been previously treated. However, even in this carefully selected and carefully monitored population, the toxicities were quite substantial. About half of patients required significant dose modifications, and only half of patients made it through the entire 8 cycles. And importantly, about a third of patients developed grade 3 or 4 cardiopulmonary toxicities, including life-threatening toxicities. So although this was very active hematologically, the toxicity profile was certainly very concerning, and this drug can probably only be employed really in carefully selected and monitored patients with AL amyloidosis.